Welcome to the Maternity Mentor. Today we will be talking about pelvic pain during pregnancy or symphysis pubis dysfunction, what causes this, and tips you can use to relieve the pain and recover. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I am also an IBCLC, I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Symphysis pubis dysfunction is a painful condition that affects many pregnant women. Luckily, it isn't harmful to babies. Let's explore what causes symphysis pubis dysfunction, the symptoms, and how to treat them. Your pelvis consists of two pubic bones that curve together to form a cradle or basket shape. The joint where these bones come together is called the symphysis pubis. Symphysis pubis dysfunction, or SPD, is more common than many people think. While the official figures show 1 in 300 pregnant women will experience this problem, many experts think the figure is actually closer to 1 in 50. SPD is also referred to as pelvic girdle pain or PGP. Symphysis pubis dysfunction is a group of symptoms that can cause pain and discomfort in the pelvic region. It occurs most often during pregnancy, but can occur after birth. The pain can be located in the front or back of the pelvis. The most common cause of symphysis pubis dysfunction is pregnancy. This is due to the hormone relaxin, which causes ligaments and muscles to loosen in your stomach, hips, pelvis, and pelvic floor. This is all to prepare your body for giving birth. The loosening increases range of motion, making joints become more movable and unbalanced. Relaxin can increase in production early in pregnancy, causing many women to experience symptoms long before giving birth. Other causes of SPD include baby's weight and position, pelvic injuries, and osteoarthritis. The symptoms for symphysis pubis dysfunction vary from person to person. Symptoms can get worse as the pregnancy progresses and your baby gets bigger. Pain is the main symptom of SPD, but for some women the pain is mild and for others it's severe. The most common locations to experience the pain of SPD include the lower back on one or both sides, the front or back center of your pubic bone, your hips, your thighs, and pain in your perineum. The perineum is the area between the vagina and the anus. Women who experience SPD may hear or feel clicking or grinding in the pelvis. Pain is often exacerbated by certain activities, including using stairs, walking, turning over in bed, having sex, moving from a supine or reclined position to an upright position, and putting weight on just one leg. Widening your stance or legs can also be problematic. This can make certain activities more difficult, like getting in and out of your car, getting out of bed, and getting dressed. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now, let's talk about diagnosis and complications of symphysis pubis dysfunction. Diagnosis requires talking with your healthcare provider. Your provider will perform a full physical assessment and look at your medical history. They may order an ultrasound to confirm the diagnosis, or they may refer you to a specialist called a physiotherapist. The physiotherapist can assess the strength and stability of your joints and pelvic muscles to confirm the diagnosis. They can also develop a plan of care to treat symphysis pubis dysfunction. Generally, SPD does not prevent the ability for a woman to deliver vaginally. In some rare cases, symphyseal separation or separation of the pubis symphysis will occur after birth. This is where the joint comes apart or gapes and becomes misaligned. For most mothers, pain will subside 2 months after birth. For some, it can last 3 to 8 months after birth or longer. This lengthened recovery time can lead to depression and anxiety. Mothers should make sure to seek not only physical care, but also emotional support from family, friends, and even healthcare professionals. There are many things that can be done to help reduce the pain from symphysis pubis dysfunction. Tips include: rest often, especially when pain is increasing. Avoid putting weight on only one leg, like getting dressed. Sit to get dressed. Avoid twisting at the waist. Avoid crossing your legs. Sit with your feet flat on the floor. Avoid sitting on the floor or sitting in a twisted position. Avoid heavy lifting, like wet laundry, heavy groceries, or lifting a toddler. Don't carry a child on one hip. Avoid standing for long periods of time. Avoid vacuuming. Avoid wearing heels. Avoid riding a bicycle. Avoid pushing heavy objects like a shopping cart. And don't carry anything in one hand only. The primary treatment for SPD is physiotherapy. The goal of physiotherapy is to improve muscle function, reduce pain, and improve pelvic position and stability. Physiotherapists provide manual therapy to normalize the movement in the joints of the pelvis, hips, and spine. They also assist in strengthening muscles in the back, stomach, hips, and pelvis through exercise. Other treatments for SPD include hydrotherapy, where the patient exercises in water to reduce stress on the joints, use of over-the-counter pain medications, including anti-inflammatory medications like ibuprofen and naproxen, icing of joints to reduce pain and inflammation, use of pelvic support devices, including a brace, sling, girdle, or wraps to pull pelvic bones back together, using TENS therapy for pain relief, and the use of crutches to assist with walking. The physiotherapist can also teach patients specific pelvic strengthening exercises like Kegels and pelvic tilts. They can also recommend comfortable positions for having sex and giving birth. Unfortunately, there is not very much a woman can do to prevent developing symphysis pubis dysfunction during pregnancy. SPD puts women at high risk for falls, which can cause further injury and pain in the pelvis. Some things you can do to prevent falls include holding on to handrails when walking on stairs, wearing good shoes with good traction, not standing up too quickly to avoid getting dizzy, eating and drinking regularly to maintain a healthy diet, and not carrying anything too heavy. It's important to understand some of the things that put you at risk for developing SPD. This includes previous pelvic pain in prior pregnancies, previous pelvic injury, high body mass index or BMI, being overweight before you became pregnant, and experiencing pelvic pain prior to your pregnancy. Maintaining a healthy weight and exercising regularly prior to pregnancy may reduce your risks of developing SPD. Speak with your healthcare provider if you are concerned that you may be currently experiencing SPD. They can assist in diagnosing you and getting treatment started. Symphysis pubis dysfunction does not last forever. With relaxin production reducing quickly after birth, many women will start to feel like themselves within a few weeks. Hopefully, the tips we supplied can assist in providing pain relief until that day arrives. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember, share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.